Our story begins shortly before 2010 on a street filled with greed, a place called Wall Street. A few people were getting rich, taking huge risks with our money. When they gambled too much, they crashed our economy, forcing drastic budget cuts and hardship. Meanwhile, big insurance companies, including Cigna, protected their billions by denying claims and coverage to the rest of us when we needed it most. SEIU members decided we'd had enough and fought back.
People who provide health care to the elderly, to the sick, every day can't afford it themselves. Is it right when you're trying to take care of yourself, working hard, 1, 2, 3 jobs, that you cannot afford health care? Is that right?
Less than a year later, Congress and President Obama listened to our cry for change and enacted real health care reform.
To the untold numbers who knocked on doors and made phone calls, who organized and mobilized out of a firm conviction that change in this country comes not from the top down, but from the bottom up, let me reaffirm that conviction. This moment is possible because of you.
As SEIU members, we changed our country for the better. Now it's time to demand change from Wall Street and the big banks.
The bankers, investment firms, real estate moguls, and CEOs that milked our economy for every last dime of profit finally experienced the chickens of their own greed coming home to roost, taking our economy down with them and forcing untold millions into bankruptcy, foreclosure, impoverishment, and the lack of health care. We saw the government rush to the aid of their billionaire friends, passing bailouts of banks and Wall Street speculators who caused the problem in the first place, but not a dime for Main Street.
Wall Street gets billion-dollar bailouts, while caregivers struggle to earn a living wage. SEIU members have had enough. In August, we demanded that Bank of America do its part to help working people. In January, hundreds of us went to Olympia, marched on the Capitol, and gave legislators a simple message: save long-term care.
What do you want? Health care! When do you want it now?
We march and rally, and then we go visit with our legislators.
Adam Klein here.
Yeah. I'm Florida.
Nice to meet you.
In fact, our union is making a stand against the cuts and saying that there are no more cuts that we will tolerate.
The whole crew here today, huh? Nice to see you.
Yeah. So...
Our hard work paid off as cuts to long-term care were minimized. We'll be back in Olympia, fighting to protect healthcare funding again in the coming year. In the fall of 2009, we banded together to stop Tim Eyman's tax initiative 1033 that would have locked us into a cycle of recessionary spending. In 2010, we collected more than 15,000 signatures for Initiative 1098, which will raise more than $2 billion in new revenue for healthcare and education in Washington. We'll be out in force this fall to help make sure 1098 passes. We'll be joined in that effort by 900 new members from ResCare in Eastern Washington. When they joined, our strength and size grew to more than 40,000 in Washington and Montana. And this summer, we spearheaded an organizing drive to bring consumer direct caregivers into our union. This 7-state campaign is still going on. New management at the Korean Women's Association in Tacoma tried to slash pay and benefits for nearly 1,000 caregivers. Our union stood up to them and won.
KWA is being unfair to workers because they're trying to make their workers pay for L&I, which no other agency and the union doesn't support.
We want to work with KWA. We love our company. We don't want to see you pick it apart. So come to the table. Bargain with us.
Workers learned that when we stand together, there's no stopping us. This year, America's most prominent and innovative champion for working families, Andy Stern, retired as SEIU's president after 14 years of dedicated service. Another good friend of 775 Northwest, Mary Kay Henry, was elected our international president. She will be a powerful force for our union.
We are now now getting ready to serve 50 million more patients. And in order to serve those 50 million more patients, we want to organize at least 5 million more of our non-union brothers and sisters so they can be part of the change that you've decided that we're going to make for every man, woman, and child in this country.
In the coming year, we'll work hard and we'll work together to better the lives of caregivers and all working people. We created the change we wanted to see in 2010, and we'll do it again in 2011.